Good morning. Today we'll be talking about understanding complications. It's a very broad topic and a very important one because of so many big different things that's going around the press, going around the country. And I think it's so important that we understand what complications are. Thank you, Dr. Onakoya and Dr. Opawoye, Dr. Olakunle, for coming on the program. It's a pleasure to have both of you here with us.
It's a pleasure
Morning,
to be here.
Pamela.
Thank you
Thanks for
very
having
much.
me.
Thank you. So if we can kick off, you know, in our society, if anything happens nowadays, people are just, so quick to hammer the doctor, hammer the, hospital. And for me, what I notice is that some of the issues that seem to arise are actually complications. And there doesn't seem to be any understanding of what complications are. So I don't know if I can start with you, Dr. Let me start with Dr. Pai. Do you have a simple definition for what a complication is?
Thank you very much, Dr. Ajayi. It's wonderful to be here once again. A complication can just be said to be an unintended adverse event that occurs, as a result of doing something else. So, for example, if there's an accident, well, it's a complication of driving. If you have an accident in a car, if you are not in the car, you probably would not have an accident. You're not driving to have an accident, but the fact that you're inside the car means there's a risk of that happening. So that's a complication. It's an unintended event. And if we're talking about complications in medical practice, is when something that you didn't expect happens as a result of something you did or did not do. Thank you.
Thank you. And then go to you, Dr. Onakoya. Can you give us a complicated definition on an understanding of what a complication is, particularly in your own area of specialty, which is surgery?
Well, I do totally agree, and thanks, Pamela, for having me once again. But I do totally agree with what Dr. Opawoye has said. The only thing I would like to add is that a complication, when it arises, then makes the original condition that much more serious or more difficult to treat. And that is why it's a complication. But it's something that is unintended, largely unforeseen. There are times when you look back, you could then say, well, maybe this could have been predicted. But, that is why it's a complication. In my own specialty of orthopedics, for example, you have a broken bone, you are trying to fix the bone, and then in the process, you make a hole where you shouldn't make a hole, or the bone breaks where you are not expecting it to break just because it is very brittle, and that had not been anticipated, then that can be a complication. Or there is more bleeding than you will have expected it to be, even after you've taken all the usual precautions. That can be taken as a complication. The one that I reserve the last is, there are not many things that will shake an orthopedic surgeon. Maybe the one on the list is a bone infection. And when a bone infection arises, typically that is seen as a complication.
Thank you. So, can you define now? Because I'm happy you mentioned that. What are complications due to? Can you classify it in any kind of way?
Well, yes, actually, there are complications that are primarily due to the disease you are trying to treat. For example, you are operating on a diabetic, and that has complications that are peculiar to it. You are operating on someone who is a sickler, that has complications that are peculiar to it.
So that's host complications?
Well, host complications could then even be further dipping down to be, someone is 140 kilograms, for example, is massively obese. Then there are complications just from that body habitus that you wouldn't expect in doing the same procedure on somebody that is 70 kilograms. So there are complications that are due to the host, due to the build of the host, due to the disease that the host has. And there are also, unfortunately, complications that could be due to the operator, for example. So yes, there are various classes of it. But I think for the purposes of this discussion, one thing to note is that there are times when a complication is already inbuilt into the procedure. And you then have to make sure that based on what science tells you about the likelihood of that complication happening, you then take measures to mitigate it. For
Can you
example,
explain that a bit more? Yes, we need to understand that a bit more.
For example, if you are doing a lengthy operation on the lower limbs in somebody who has some specific medical conditions like high cholesterol, like diabetes, in somebody who smokes heavily, in somebody who is obese, very obese, then the risk of a blood clot is high. And because we know that the risk of a blood clot is high, then what you will want to do is to take measures that will ameliorate that risk. For example, the patient should not then spend days and days in bed. So it's not that if you then say, oh, you need to rest to recover from the surgery you've had. If anything, you need to get that patient out of bed that very day, at the latest, the very next day. We know that some people, the blood flow in them is typically sluggish, again, because of some medical conditions they have. So when you operate on them, the idea must be best practice is to get the blood flowing, get the blood thin and flowing as smoothly as possible. That might involve prescribing some specific drugs like blood thinners. It involves moving the limb immediately after the surgery or as soon as pain control allows, getting the patient out of bed. So yes, there are risks that are identified that could present as complications, but science also teaches us how to manage those risks. That's what I was trying to explain.
No, that's fantastic. So you've really outlined how things like DVT, which is the clot in the leg,
Yes.
occurs. So how do things like nerve damage occur after bone surgery, arise after bone surgery? That's a complication, isn't it?
Well, yes. I mean, nature has done very well. The geography of the body is very precise. Things are normally where they should be, and they tend to stay there. And if you know, I mean, what I call geography is what medics will call the anatomy of the body. That anatomy is precise, and nerves tend to travel a predictable course. Blood vessels tend to travel a predictable course until something happens to move it. The patient has had surgery in the past, so that terrain is no longer a virgin terrain. An injury has occurred, there is a scarring in that area, and things have moved from where you will normally expect them to where they usually are not. And the patient is then having the second or third surgery in that limb. Then the risk of damage to structures is higher. And this has nothing to do with the competence or the knowledge, the skill of the surgeon. It's just because things are not where you expect them to be. Where the skill of the surgeon comes in is to then be able to say, it doesn't matter where this structure is. We know it could have moved, so I will find it and I will secure it. But at times, things are so out of place that in the process of finding it, they can then suffer a damage. In orthopedics, we also
sorry, I actually want to stop you there because that actually explains a lot. Because I'm sure you two have recalled that in the press, there's some cases of they took somebody to one hospital, they had an operation, they now took them to another hospital, they had another operation, they took them to that. And you think to yourself, so all these multiple hospitals, all these multiple operations, who knows who has given them information on what happened in the last time? It can be a problem when X and Y and Z and they keep moving them from place to place. That actually what you just explained earlier could actually be a huge part of it. Please carry on.
I think, okay.
Absolutely. Yes, Folani, you wanted to say something?
Oh, yeah. I mean, I think you really hit on a very important point, like Pamela is saying, which is, for me, number one, if you don't need a surgery, don't do it. And we find a lot of that, when you look at one of the most common procedures, which is the cesarean section, and you find people, it's at some point turned into a fad. And people just like, oh, I want to deliver on a particular day. I want this bad day to match my own. And then you go and cut. And the challenge is that once after that cut, every other delivery, you almost have to cut again. And like Dr. Onakoya has said, everything is no longer straightforward. The way you've planned the anatomy, the healing is not necessary. I mean, I'm a Yoruba man. The Yorubas will say, "Ujwa akpaya ko dabi ujwara," some like translated to mean that a place where healing has occurred is not the same as the fresh one. So it could lead to all sorts of issues. And then all of a sudden, you're trying to cut where you think the uterus is, and before you know it, urine is leaking. And then it's discovered that the ureter has passed through that area because of a previous surgery that has been done. So I think it's very important. Surgery is a serious business. If you do not need to do surgery, don't do it, because every surgery makes the next surgery more difficult. Thank you.
Wow, that's important. Thank you very much. Dr. Onakoya, back to you. Can you share an example where early detection of a complication made a big difference in patient recovery?
Oh, yes. And as you ask that, a particular case comes to mind. Young, skinny, early teens, very active fellow, very, very active. And he was the star on the football team of his school. And he had been brought to see me because he suffered an injury playing football. I think it was some knee injury of some sort. And I had operated on him and everything had gone well. And just because the surgery finished late in the evening, I had then said, look, there's no point you going home at 7 p.m. We'll keep it till the morning, get pain control done. And I came in to see him early in the morning, and he had a few skin blotches. And I just wondered what this could have been. A young man, he wasn't on blood thinners or anything, but he had these skin blotches. And pardon me, but orthopedic surgeons are nowhere as clever as dermatologists. So I had absolutely no idea what this was. So I called the medical officer and I said, what could this be? And he said, oh, sir, these are, I think either they are petechial hemorrhages or something. Anyway, we took it serious. We got the hematologist in, and it turned out that this gentleman had hemophilia. And meanwhile, I had done an extensive surgery around his knee. I had done all the things that, one should have done. Surgery had gone well, but he could just have easily had bled into that wound, massive wound complications. That is, I could just imagine everything would have gone south from there. And I never, ever forget. In fact, I can see him right in my vision now,
Wow.
that skinny young man. And all it took was paying attention to these few skin blotches that he had. I mean, thank God that he was also fair-skinned. But again, it just shows that, one, yes, it's true that we enjoy being consultants, but there are some things that the medical officer contributes with regards to knowledge. But I mean, that we were saved on that one.
That's fantastic. So can we talk about handling complications? Like maybe implant rejection or something in joint replacement? And then going on to, very importantly, I want to really talk to Dr. Olakunle about infection.
Well, we put a lot of implants in, and implants, we put a lot of them in. They are not rejected as such, but it used to be thought that they add to the risk of infection. Now, science tells us that not necessarily so, but just because you have put implants in, then there is a very defined pathway for the rehabilitation, for antibiotic prophylaxis, and for all whatnot. The presence of implants also means that the implant can fail. It can fail early, it can fail mid-term, it can fail long-term. We know reasons why they fail. Infection tends to be the dreaded complication, really, when you have put in an implant. Also, is when bone is brittle and you are trying to use this metal to hold on to brittle bone. And at times, the bone just doesn't have enough in it of itself to be appropriately held on to by the metal. So yes, putting implants in presents its own challenges. To the specialist who knows what he's doing, there are challenges that can be managed. What is important is that to have a very, very detailed discussion with the patient at the beginning. From time to time, people come to me and they say they want the implants removed. And the implant doesn't need to be removed. It can be there for life. Because don't forget, to remove it is another operation, is another anesthesia, is probably another period of using crutches. But if this had not been discussed before it was put in, at the consent stage, then there are all sorts of misconceptions. Some have a feeling that the implant can get rusty, so they want it removed. So I think what is also important for me to stress at this point before I yield ground to Folarin is the whole consent process. And consent means that the surgeon must explain what he wants to do to you, what the diagnosis is, how they got to that diagnosis, what your options are. And at times, surgery is not necessarily the only option. There might be other options. So what are those options? It should be explained to you. If it is surgery, what are the benefits? What are the potential complications should be explained to you. And I think every patient has the right to a second opinion. You certainly have a right to question. So ask your surgeon, sir, ma, have you done this operation before? How many have you done? How is it in your hands? Can I speak to somebody else? If he gets angry at you asking questions, then you are probably in the wrong place. I think you need to see somebody else. But certainly consent is important. Asking questions is important. Knowing all there is to know about whatever surgery is being proposed is important. Getting a second opinion just as well also. Thank you.
Thank you so much. Dr. Opawoye, can you take it from there? We need to know, you're a real specialist in this area of infectious disease. And we want to understand, how serious are post-surgical infections? And people want to know, they said that the surgery was sterile. They said it's a sterile procedure. So how come these post-surgical infections even occur?
Thank you very much, Dr. Ajayi, and thank you, Dr. Onakoya, for stressing those very important points of getting a second opinion. And I was just chuckling when you said you had someone who was 140 kg and was very obese. I think my largest patient was 183 kilos, and we couldn't measure him on the scale. I had to, the scale said stop. So after he completed a full circumnavigation, then we had to add the rest. And then we were taking him for surgery. It was bigger than the operating table. The operating theater said, please stop at 180 kg. So imagine all the things we went through in that kind of a very, very challenging case, So maybe it's just another reason to keep the weight down. If you have to do surgery, it's going to be a problem. So Dr. Pamela, surgery. Surgeons hate them. And because a typical surgeon wants to operate and move. We physicians can see one patient for 40 years. It's not a problem. We'll see them from the time they were young. I have a patient now who he's in his 70s. His doctor is also in his 70s. So they are threatening themselves who will die first, but a surgeon isn't that way. A surgeon wants to finish the procedure and move on to the next patient. On my way home, coming to this to quickly prepare for this interview, I was passing through Joelegba. My uncle, who was there, pointed to an hospital, incidentally an orthopedic hospital, where he told me that this time last week, boys had surrounded that they were going to burn down the place because they brought somebody and the person died there. And then this person that died had a hole in the heart. I was very sick. And then, the boys didn't understand that. They were just like, he was alive and he's dead. Somebody must pay. And, so people really need to understand that complications can occur, and we have to sort of guard against it. Maybe we're in a religious society, pray against it, and see what's up. So now,
but I think before you even go further, I'm so glad you mentioned it. People also need to realize that death can occur.
Yes.
Oh, sure.
Because it's actually coming to a point. A lot of people think that no, the death is caused by someone, but actually death occurs. We are all born. And we will all die. So, in fact, it's something that we need. Oh, wow. We don't even have much time, so don't let me distract. Please, we only have 2 minutes left. Can you continue, please?
Well, so Generally, what the surgeon really tries to do is to make sure that the process preventing infections in surgery starts before the surgery. Like Dr. Onakoya said, patient preparation. Is this patient stable enough for surgery? Have you controlled factors like diabetes, sickle cell disease? You've looked at if, for example, a patient is on a blood thinner. If you take that patient in for an elective surgery, you would have a lot of problems because all of a sudden there's a lot more blood than you planned for. Blood is a rich culture medium, and then also some things could occur. So before the surgery, you're getting ready, and then of course you make sure that as much as possible your procedures are sterile, you have good equipment, everything is clean, you do your hand washing, intra-op and all that. But very important is also the post-op care of the patient, because you can do the best surgery in the world and then somebody doesn't take care of the wound, or you go and soak the wound in water, something you're not supposed to do, and then the wound breaks down, then there's a problem. But that being said, it's very important that these things are recognized early. Dr. Onakoya gave an example earlier about a boy who had a chemotic patches. After I'm sure they were chemotic patches, not petechic, but he's a surgeon, he doesn't bother. And they were able to pick it up early. So a very wise old surgeon or friend of mine will tell you that complications is not the problem. The issue is that you must detect them early and then you must correct them. Now, once you're able to do that, then you are able to save the day. It's very important to note these things could happen and find ways to prevent them as much as possible. Thank you very much.
Thank you so much. I wish we had more time. In fact, I think we're going to have to do a complications too to talk more about this. But if you can you just give us a couple of words, last words for our listeners? Dr. Opawoye, before I go to Dr. Onakoya.
Thank you very much, Dr. Ajay. It's always a pleasure being here on the show, and this is very enriching discussion. I think it's important to understand that complications could occur as a result of surgery, and so every single surgery must be a well-taken decision. Always try to seek a second opinion and discuss with your doctors beforehand. Complications can occur, but they can be detected early. Sometimes they can be prevented, other times they cannot, but they can be treated. And it's important to understand this. Thank you.
Thank you. Dr. Onakoya.
Yes, I will just add to that by saying when you are having that discussion with your doctor or with your surgeon, please ask questions. Ask questions to, have confidence in that process. And if those questions will include how safe is this procedure? What are the things that could go wrong? What are the likely complications? And are you at any particular risk of any of such complications? And what remedies are in place? Then please do. Certainly don't, if anything is going to go wrong, it's going to go wrong with the patient. So please make sure that all the indices are loaded in your favor as much as is possible. Thank you.
Thank you so much. It's been a very enlightening discussion. And I really appreciate both of you for coming on the program. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.